Benninger.
I'm Jordan Adams. And I'm Molly Edwards. Today we're going to be talking about antidepressant medications, specifically fluoxetine, and better known as Prozac. We're going to have a guest. Her name's Lexi, and she is a nursing student. She's currently taking pharmacology and is just struggling and having a horrible time. We have a video of her about 6 weeks ago at her lowest that we're going to show you all. And since then, she's been taking this medication, and we're going to hear from her live about how she's doing. Here's this video.
I just don't feel like myself anymore. I used to be a happy person that enjoyed hanging out with my friends. I got good grades, and I had a full-time job. Now, I just can't seem to get out of bed. It all started when I started taking the class pharmacology. I'm sorry, this is just hard. I thought that everything was just like any other nursing class. And I studied, and I seemed to not get the good grade. So instead of studying harder like I usually do, I just started sitting in my bed all day. I have no motivation to get up to do anything. I just sit here, I eat my stuff, I don't ever clean. And I just look over the information, and it just doesn't seem to sink in. I tried to go to a counselor, but they just told me to get over it. My parents, the same thing. I really need some help, which is why I'm reaching out to you.
Okay, that was our friend Lexi. She is currently been taking fluoxetine, or better known as Prozac. It's an oral extended release capsule. It is used for major depressive disorders, bulimia, OCD, and it can be also used together with other medications to treat depression caused by bipolar disorder. It selectively blocks the neurotransmitter serotonin, which causes higher serotonin levels at the nerve endings, which intensifies responses and relieves depression. It takes about 4 to 8 weeks to see results with this medication, and if you decide that you do want to stop taking them, you have to call your doctor so they can taper you off gradually.
Some other severe side effects could occur, such as sexual dysfunction, weight loss, serotonin syndrome, GI bleeding, so do not use this with patients with high GI issues. Also, do not take NSAIDs with this medication. And you can have sleepiness, faintness, lightheadedness, and do not take Prozac if you have taken MAOI in the past 14 days. Some contraindications with this drug is to avoid alcohol and CNS depressants, NSAIDs, pregnancy, and thiazidine, breastfeeding, and St. John's warts. Implications for nursing care include monitor for seizures in patients with a history of seizures, supervise patients closely who are on high suicide risk, and monitor patients with hepatic or renal impairment. Patient and family education could include do not drive or engage in potentially hazardous activities, monitor glucose, especially in people who have diabetes, note that the drug may cause seizure activity, and do not breastfeed while taking this drug, and also notify your physician of intent to become impregnant. Other characteristics or components or effects of this medication that differ from other classes in the same class. This drug is safer than other tricyclic because SSRIs do not have an anticholinergic effect or sedative effects.
All right, now we're going to bring on Lexi.
Hi guys!
Hi!
I'm so happy to be on the show!
All right, so it's been a few weeks, Lexi. How are you feeling?
Oh my gosh, I can't even describe you how much better I'm feeling.
Good.
I feel like my old self again. Like, I just feel like taking over the world. I am going to my classes, I'm doing well in my clinicals, I have my friends back. It just feels like my old self again. I no longer sit in bed and cry all the time. I have so much energy to do everything.
Oh, I'm so glad to hear that. And did it take a while to set in, or?
For me, it took about 4 weeks.
Okay.
But they said, like you guys said, I was one of the lucky ones that it worked so quickly. And seriously, if any of you are struggling with depression, please, please, please talk to your doctor about taking these. It changed my life around.
How's your
Good.
pharmacology class going?
Oh my gosh, it's so much better. I just took my last test and I got a B. I just am such a different person. My mom even said, she was like, when I talked to you on the phone, you seem like a totally different person. And I have you guys thank for this. So thank you so much.
Glad we can help.
Did you have any side effects?
I didn't, but I know that some people can. My doctor warned me about side effects of taking these drugs, but I haven't had any. I mean, I guess I'm just one of the lucky ones. And this, I know that he recommended me to these because they had less side effects than most drugs do. So it was just right for me. And I just can't describe to you how happy I am.
Good. Good, well keep up the good work, and don't, just remember now that you're feeling good, don't get off of these pills, you know.
Yeah, I'm not going to take off of them.
Good.
Alright, thank you guys again. Thank you for having me.
Oh God, thank you. So that was a successful story with a patient taking SSRIs. Thank you for watching The Nurses, and have a great day.